Everyone wants that perfect smile, but dental treatments can sometimes be expensive and deter many people from even getting them, or maybe they're not covered by health insurance for some people. Harmon Dental Center is making those dreams a reality without breaking the bank. Dr. Brad Harmon is here to tell us more about all the services they offer. Great to have you here.
Thank you.
Well, talk a little bit about these full mouth implants. Like, how do they work and how do they restore the smiles of your patients?
Yeah, so implants can oftentimes replace broken teeth, missing teeth, people who are in dentures that need to have a complete rehabilitation. Implants can oftentimes be a great solution to restore them back to health.
Why are they a more viable option than, say, just replacing a tooth here and there?
Well, because sometimes the entire mouth has been destroyed to the point that really doing single implants or single tooth restoration doesn't make any sense.
Yeah.
So a full mouth or full arch of implants oftentimes is the more cost-effective and efficient way to get the mouth restored.
Plus, too, probably when you're looking at that, there can be some gum disease, some other things that are at bay that you just need to go in and replace everything.
Yeah, oftentimes gum disease is a big reason that people need to have their teeth replaced.
Yeah. We forget about that, right?
Right.
We have some before and after pictures we want to show of some patients that have come in. If you can kind of tell us what we're looking at here. Yeah,
this is Sherman. Sherman had some missing teeth, broken teeth, chipped up teeth, was kind of tired of chasing that problem, and so he decided that he ended up doing just his upper. We decided to save the lower teeth, so sometimes you don't have to do the entire mouth. We can do just one arch at a time, or we can do both, but in his case, we needed to do one, and we did his upper, and he looks great.
Wonderful. Are the full mouth implants, are they for all patients?
You know, there's some patients that really aren't
candidates. Or do you kind of look on a case-by-case basis? Yeah.
Sure, we have to look case by case. I mean, not everyone has, you know, certain health conditions can be a contraindication to treatment, but for a vast majority of patients, this can be a really great remedy.
We see some of the afters here of this patient. What was
this
her
is
story?
Sarah. Sarah was, again, she had some broken teeth, missing teeth, infected teeth. She ended up doing both top and bottom and having implants placed all at the same time, both top and bottom, and we restored her back to health.
Remarkable change. Absolutely remarkable. Even from a health perspective, after that, she probably feels better, right? Able to chew, able to not have indigestion. I mean, it probably affects so many other things.
Yeah, you know, Claudia, that's a great point. It's not only about restoring their smile, it's about their confidence and giving them back quality of life. I've had so many patients say that now they feel comfortable going out to family events or going out to eat without embarrassment of a tooth breaking or hurting.
Right, right. And I just can only imagine all the other health problems that could be happening, you know, because of something like that. So it's I think so often we kind of look at it, oh, you look better. Well, it's also a whole lot going on. It's mental health, it's physical health. It helps with so many other things.
You know, the mouth is the gateway to the rest of the body. So if it's unhealthy, the rest of the body is, and sometimes the opposite is true. Sometimes a healthy mouth will contribute to a healthy system.
And a lot of times the reason that people don't want to go do it because they're concerned about the cost. How do you work with patients, and what are the different ways to kind of make sure that health insurance can take care of some things?
You know, that's a great question. So oftentimes these kinds of treatments, because of the comprehensive nature of them, they exceed what an insurance benefit might cover. So we try to do our best to maximize an insurance benefit with patients. We have a great implant team and financial planning team that helps make these treatments affordable for people. We have great financing for folks that need that. We help bill their insurance for costs that might be covered under insurance. So we try to make it easy for them.
All right, Dr. Harmon, pleasure to meet you. Thank you for coming in.
Thanks for having us.
For more information, if you want to connect with Harmon Dental and Dr. Harmon, just call 502-325-3994 or visit harmondentalcenter.com.